Dr. Toney KISS series. How does subluxation take place? How do we get subluxated? Again, just a little quick recap. A subluxation is when you have a misalignment in one of the vertebrae, one of the bones in the spine, that misalign in relationship to the one above it, below it, or both, putting indirect pressure on the nervous system, be it the brainstem, the spinal cord, or the nerve roots themselves, creating malfunction in the body. Okay, how does that happen? 99% of the time it's trauma. Some type of trauma gets this bone out of place. Now the ones that are obvious are your motor vehicle accidents, when you have a big crash and you're in severe pain, you start having malfunction in your body as a result of it. Those ones are obvious. But the subtle ones are the ones that we overlook. I often ask patients, have you ever had any accidents or falls, get knocked unconscious, fall off a horse, a chair, a ladder, a step stool, down the steps, fall on ice, blah, 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 blah. And inevitably it's no, 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 no. Or they'll say, I had a few minor fender benders. When a patient says minor fender benders, the ding, the light bulb goes off in our head, because we realize some of the smallest traumas are the ones that cause the most problem. So, fender benders are bad because your head is going, even if it's 5 or 10 miles an hour, you're going from a standstill, you're going from a stationary position to a standstill in such a short period of time, so it looks like this. In a very fast, rapid motion. But you're so excited after the accident or incident itself, you don't recognize that there's a problem up there. And maybe in a couple days you got some soreness, and then a week or so it goes away. But that bone misaligned did not forget. So trauma, some type of trauma, whether it's a fender bender, a small fall on your buttocks. This area here is most vulnerable, the upper neck, because energy takes the path of least resistance. This is the area right here, and that's the most important part because that's where the brainstem is. Some type of trauma caused it. That trauma could take place a week ago. That trauma could have taken place a month ago. That trauma could have taken place a year ago, or even decades ago. You will not experience symptoms after a subluxation immediately. Not always. Sometimes, but not always. Most of the time it takes days, weeks, months, years, or yes, even decades later before you experience symptoms of subluxation. But what causes subluxation? Trauma does. As long as we continue to have our traumas and we continue to live in the world that we live, we pay the price of this developed country, because other traumas we don't think much of it. It's more the chronic type trauma. Sitting in soft chairs, sitting on soft furniture, sleeping in the beds that we do, using the pillows that we do, having a 10-plus-year-old mattress, the cars that we sit in, the way we sit in our cars, the things that we do. We talk on the telephone, we're washing dishes. These things also can cause subluxation. It's something structural that causes it. Dr. Toney KISS series.